exciting, Anae and I today, to present again on the dashboard. It's always great working with you, and as you just said, it's it's many years of doing this together, or from links to the dashboard. So hi everyone again. My name is Ben Katz. I'm a senior project manager at the CUNY Institute for Implementation Science and Population Health. We're based at the Graduate School of Public Health at the CUNY in New York. And I'm joined by my colleague today, Anae Patel, to talk to you about our work on the Ending the HIV Epidemic Dashboard in New York State. As we more commonly refer to it, the ETE Dashboard, which amazingly has now been around for nearly 10 years. So a big anniversary for us coming this fall. So just briefly on today's webinar, we will be providing an overview of the dashboard, including the scope of data and information available on the site and how to find the data you need or are most interested in. After my intro, Anae will then take you on a deeper dive into one of our newest interactive data pages, the Community Snapshot page, released just this past December. We'll also discuss some ways that people have used the dashboard in the past and offer some simple suggestions on other ways to use data information from the site. And then we'll have Q&A at the end. So whether or not you're already familiar with the ETE dashboard, or this is your first time being introduced to the site, we hope that after today's webinar, you'll have a better understanding on how to navigate the site, how to find the data that's most relevant to your work, your region, your county, or if you work in a particular topic of data, particular topic or section of HIV/AIDS care, that you can find what's most useful to you. I also want to briefly mention two of our other related projects, the New York State Hepatitis C or HCV dashboard and our forthcoming STI dashboard for New York. We launched the HCV dashboard in May 2022, and we are going to be launching the STI dashboard very soon. But we do have a landing page up for the STI dashboard where you can sign up for updates and see our launch announcement, or when we have our launch announcement. So if you can join our email list for that. We'll share some info later on connecting to those projects, but just briefly, if you're on the ETE site, you can scroll down to the footer, which I've shown here, and we have two logos for our projects, and both of those link to those separate websites down there. Okay. So due to our limited time today, and wanting to spend as much time as we can demoing for you our data viz pages, I'm not going to spend too much time talking about the background and origin of the ETE dashboard. But if you are interested in learning or reading a little bit about that, you can visit our About page on the site itself. I just will reiterate our key aim or purpose of the project, and that is to measure, track, and disseminate actionable information towards achieving New York's ETE goals, which were set out, over 10 years ago, or about 10 years ago now, in the ETE blueprint. And we ultimately do that by presenting official ETE metrics, as well as by curating and displaying HIV-related data from many different sources, so that we can present a full picture, a more comprehensive and interactive experience for all our stakeholders. So I just want to spend a few minutes now going over briefly all the different sections on the dashboard website, and I'll do that by starting on our homepage. We actually redesigned this homepage over this past year, so if you haven't been to the dashboard in a long time, it might look slightly different to you. Up on this right side panel, we have added this moving infographic or short video, animated video with some high-level statewide annual data. You can actually go onto the video itself. You can make it full screen on your own browser if you want. And you can also click on these three dots and download the file itself if that file is of use to you in any reports or sharing among colleagues, etc., etc. Okay, below that we have these icons across horizontally, and by scrolling over each one, you can see the names of different categories, or we call them data realms, and it's how we organize information and data across the site. So, for example, the linkage icon, paperclip, is for new diagnoses. The AIDS ribbon icon is where we have some deaths and hospitalizations related data. The pill icon is for prevention, yada, yada. And if you're visiting the site and you're actually just know exactly what you want and you're not really here to browse, you can click directly on one of these icons and it takes you to the available data that fits under that category. So for example, if you're just looking for PrEP data, you could click on the prevention icon. It'll take you to our data directory page, and I'll go over this in a little more detail later, but it'll take you right to whatever prevention related data we have on the dashboard. And so this is a preview of our PrEP use data, which takes you to, the button takes you to even more data about a PrEP on the dashboard. So back to the homepage. Okay, scrolling down under that is our How is New York Doing section. And here what we've done is taken data across the dashboard that is our most visited data. We know that from like tracking user hits and how much traffic we have to certain areas of the page of the dashboard. And we featured some of that data right on the homepage. So here is new diagnoses trends and some new diagnoses outcome measures. Toggling to the right, we have some highlights of PrEP use data at the statewide level, a trends of PrEP numbers, a bar chart showing disparities by race. Here we have a viral suppression trendline chart with a county level map of viral suppression rates across the state. I'm not going into detail on this stuff today because this is our homepage, this is our splash page, this is where we kind of just present overview or summary information of what's inside the dashboard. Under the How is New York Doing section, we have a latest HIV and dashboard news section, and that is simply some snippets of our blog posts that we send out on almost like on a monthly basis. And these are just, you can link right to our blog page from this section. I don't need to get more into that right now. And then finally, right up between that and our footer, we have this "We want to hear from you" message banner. And if you ever have comments, questions, you're troubleshooting an issue on the site, you can't find data you're looking for, that you seem to find a bug, you can click right on that button. It'll take you to this form. We call it our suggestion box. And you can leave your comments or suggestions here, and then name and email contact. It's all optional. Or you can be anonymous if you'd like. But that is always helpful for us to keep improving the site. Okay. So that's essentially the homepage. That said, we use our, like many websites, we have this navigation menu across the top. I'll get back to data in a moment. We have 3 other sections on the site: implementation, blog, and resources. Under the implementation section of the dashboard, it's where we house a few tools or features about like what's New York doing and the HIV epidemic, so like program related information. We also have this tool called the policy tracker. And for just a moment, I'll show you this page. It's not something we're going to go into depth on today, but we use this page to try to capture all related legislation or other policies that have been passed since the ETE Blueprint launched that are related to recommendations to end the epidemic or HIV related policies in New York State. It's currently organized by Blueprint recommendation aims. And then within each box, if you kind of click into it, there's a timeline. So for example, if I'm looking at 2018, and this is about enhancing services to support non-medical needs of all persons with HIV, I hover on an orange circle and I can see that there was legislation, enacted in 2018 around the rest of state enhanced shelter allowance, and you get a little more information about that policy point. I'm not going into more detail today because there's a lot here on this page, but anyone interested in does advocacy work or interested in past policy work that has been done in New York, this is a great resource. And we are working this year on doing a slight redesign or adding a couple things to this page to make it easier for you to find the information you're looking for, sort of like a keyword search or just a general search option on this page. Okay, so that's implementation. Going over to the blog page, it's updated on a monthly basis, give or take, where we do program highlights. We feature infographics for HIV awareness days, and we'll send an email out to anyone on our email list announcing we have a blog post, and so people can come read about that. It's where we announce new data or new data new data visualizations that we've put up on the site as well. And for example, like after this webinar is over, we'll probably have a blog post, posting the link or something and connecting back to NYLinks on this page itself. Finally, under our resources tab, we have we have a resources page that has a list of external links, anything from testing location links to stuff for information for providers or advocacy. We don't often update this page, and we know there's other sources, both at the Department of Health and other places, for people to get resources around this stuff, but this page does exist, and it's here under resources. We also have our infographics page, and this is where we store or archive all of our past infographics we've created. And again, these usually tend to be around the HIV awareness days, the national ones, and what we'll do is we'll take data from within the dashboard, and we work on designing these little packages like GIFs or something, these little GIF files, which are easy to share on social media, or if you have a report. And it's a nice way to capture some key information or summary data of around certain communities or populations affected by HIV. Anyway, so those are all of our ones we made in the past are stored on our infographics page here. Okay. Let's get to the data finally. So going back to over the data page, I just first want to show you our ETE metrics page. The ETE metrics page, well, let me step back. Over the years, the AIDS Institute, in collaboration with stakeholders from across the state, has identified a slate of official metrics to track progress towards ending the epidemic in New York. These metrics are updated on an annual basis. The data is released and presented every year at the New York State Ending the Epidemic Summit in Albany. And you can find these metrics either directly from the homepage, you can link to this page, or going like I showed under the data navigation menu. So each of these metrics are displayed separately. There's a left side menu to toggle between different metrics. On the right side of the chart, on the right side of the page, excuse me, there is a way to look at just statewide data. We actually also split it for citywide as well. And depending on the metric chosen, you can filter the data by sex, age, race. On other pages of the dashboard, you can look at region level and county level data. This page is specifically the statewide metrics. And on this page, we show the blue line is the actual data, and the orange and the purple are like the targets and goals set by the state over the years. And just I'll mention one other thing, and you'll see this on some other pages across the dashboard for New York State data. We do put this gray bar over 2020, and it kind of recognizes that there was some incomplete data in 2020 due to impact of a COVID-19 pandemic. So it's just when sometimes there's an inflection point in data, or trends look a little off, or anyway. So it helps user come to the data for the first time and notice that there's something was going on in 2020, as we all know. Okay, so back to the main content of our dashboard is our data, and we have a page called our data directory. So the idea of the dashboard is that we brought in data from many different sources that were previously or traditionally in separate places. So for example, if you are working putting together data around HIV testing estimates, new diagnoses, or linkage to care, you'd have to go to separate places. And the dashboard brings all this data together in one website to hopefully make it easier for you and the public to find what they're looking for. And accordingly, we've organized this data by realm or category. So on the right side, you'll see these section labels: prevention, new infections, testing, new diagnoses. And this helps, this can help you navigate to find the data you're looking for. So for example, I used the PrEP example earlier. Let's say you're interested in trends in linkage or something. You can go down to new diagnoses and linkage to care. You can toggle over to trends. And then we show a preview image of the statewide data on new diagnoses. It tells you the measures that you'd find when going through or navigating into this page. So this page, it has data on new diagnoses, linkage to care, viral suppression within a certain time frame, what years of data we have, what geographic levels we have of data, and what filters are available. And then the blue button takes you directly to that page. So I will just show you that process. So here now you're on our trends page for new diagnoses. I'm not going to demo this page today. We're going to focus on the community snapshot page later with NA, but here's an example where you've done your work to find where you want to get to on the dashboard. And once you're here, this is where you can start playing around with our interactive visualizations, filtering data by region or county, et cetera, et cetera. Okay. Oh, finally, just on the data directory page here, I would like to just note that there's a lot going on, and we did create a list view. So there's a highlights view, which is the default setting, and then there's a list view. And what that does is it just takes all the images and the pictures out, and it condenses everything. So if that's how your brain works and you want to try to scan quickly for the information you might be most interested in, again, it lists it out on the left. It tells you if you have it for this way, we have statewide or we have citywide data. You can still click on a preview for what's in that page when you would navigate to that page, for example, and then visit a link to visit that data page itself. Okay, I will now pass on the mic and the presenter role to Ane. While he is getting set up, I just want to mention one note about our data and our data sources for the ETE dashboard. So most of the data on the ETE dashboard is population level. So for example, it comes from HIV surveillance or population-wide surveys like the Community Health Survey in New York City. And that represents data for an entire population. For example, and which includes data on all diagnoses or lab test results that have been reported to the health department. So it's remember that if you work at an organization or a clinic, that when you're comparing your own metrics or measures data from your clinic or that you're comparing it to population level for a whole county or region. So for example, measures like linkage and retention rates could look much lower on the dashboard than they do within your own catchment or within your own clinic, because the population level data sort of also includes all these maybe folks who aren't being reached or aren't being retained in care. I think many of us know that, but it's just something important to mention. And I remember back in my early days with Steve, it was an important piece that we had focused on when presenting data and comparing surveillance, for example, surveillance data to clinic level or organization-wide data. On that note, I am going to mute myself and take it away, Ane. Thanks.
Hi, everyone. As Ben said, my name is Ane, and today I'm going to be walking you through the dashboard's newest edition, the Community Snapshot page. This page is a tool designed out of direct feedback from dashboard users at the 2023 New York ETE Summit to provide a quick reference for understanding the local impact of HIV in our communities by aggregating different metrics and visualizations from across the dashboard in one convenient location. It can be accessed either from the data dropdown from the navigation menu here, or on the data page in the Tracking ETE section here. It offers a comprehensive overview of key points that highlight the current state of HIV in specific areas or for specific population groups. This information is crucial for making informed decisions and implementing effective interventions. On the Community Snapshot page, you'll find various types of data, including prevalence data in the form of a map showing persons living with persons living with diagnosed HIV, as well as an HIV care continuum of persons living with HIV. There's also a new diagnoses care continuum featuring data from the latest available year's data, as well as a trend for new diagnoses, linkage to care, and viral suppression. Data for new AIDS diagnoses, HIV-associated hospitalizations, PrEP use, and testing are also available. This data is available for both New York State and New York City. And in the New York State context, it is available by Ryan White region or by county. And in New York City, it is available at either the borough level or by UHF neighborhood. On this page, data for the borough level and the Ryan White region level are able to be stratified by age, sex, or race, while data at the county level and the UHF neighborhood level are not. However, on some of the individual pages that these visualizations are sourced from, you may find that you are able to stratify further levels of data. Each of these visualizations contains an individual toolbar, which showcases individual chart notes pertaining to that visual, as well as indicator definitions, a download function that allows you to download that individual visual as either a PNG or a PDF, an expand function, which allows you to view the visual in greater detail, as well as a link button that takes you back to that visualization source page. While data presented on the Community Snapshot page is highly valuable, it's important to be aware of potential discrepancies between surveillance-based and non-surveillance-based data, including testing, PrEP, and hospitalizations. These differences can arise due to various factors, such as the differences in data stratification methods, reporting delays, or variations in data sources. You may also find that data may appear suppressed in cases of low case counts, where the counts will be shown, but percentage measures based off of those counts will not be shown due to low denominators. An example of this can be seen when we go to New York State and select Allegheny County. You can see that in 2023, there was one new HIV diagnosis. However, the new diagnoses continuum, linkage to care, and viral suppression charts are suppressed due to the fact that drawing measures based off of this one diagnosis proves inconclusive. Data may also be misaligned, as stated earlier. An example of this is when we select the age groups 20 through 29 on New York statewide. You'll see that the hospitalizations, PrEP use, and testing for HIV in the past 12 months are not displaying the exact match for the data that you selected. This is, as stated earlier, due to differences in age groupings within those data sets. As you can see in the hospitalizations chart, the data that's actually being displayed is from ages 18 through 29. While in the PrEP use and tested for HIV in the past 12 months, we're actually displaying two age groups because there's an overlap with the selected age group that you put for the surveillance data. These mismatches are underlined in red, and you can see the explanation if you mouse over. Data may also be misaligned due to region selections. For example, when you select the Syracuse region and you go to PrEP and testing, you can see that the region label is Central New York. This is actually because in these data sets, the Syracuse region is aggregated with the Binghamton-Ryan Light region. So this is the closest available match to your selected data. Community organizations, healthcare providers, and policymakers can leverage the data from the Community Snapshot page for various purposes. For instance, they can use it to plan targeted interventions, apply for funding, and develop policies that address the specific needs of their communities. One great feature about the Community Snapshot page is the easy-to-share reports generation tool. seen here. This allows users to quickly create and share comprehensive reports with stakeholders, ensuring that everyone has access to the same critical information, allowing these visuals to be easily incorporated into presentations, publications, and grant proposals. For these PDF reports, all chart notes and indicators are compiled at the bottom. An example of a generated PDF report can be seen here. And this is an example of the compiled notes. One feature I also forgot to mention is the ability to compare your selected region back to New York State or New York City. This can be done by selecting this checkbox right here that appears when you select a county or region from the New York State map, or borough or neighborhood from the New York City. In conclusion, the Community Snapshot page is a powerful tool for understanding the local impact of HIV. By being aware of the types of data being presented, potential discrepancies, and the importance of context, we can better interpret the information and use it to drive positive change in our communities. As this is a new page on the dashboard, we would very much appreciate your feedback should you choose to use it. A link to the page's feedback form can be found here on the page's right-hand side via this clicking on this blue feedback button. Thank you so much, and I'll turn it back over to Ben.
Thanks, Ane. So I posted to everyone the link to the Community Snapshot page that Ane was just demoing for everyone directly in the chat. If people want to take a look at that today or later. I am going to go back and share a few more slides before we get to the Q&A. Can everyone see my screen now? Great. Okay. So I'd like to take a few minutes to talk about some ways that people have used the dashboard in their work before. I'll mention a few examples here that we've heard about, but please, if there are other ways you or your colleagues have used information from the dashboard before in your work, we'd love to know about them. I encourage you to chime in a bit when we have the Q&A or even add them to the chat. So here, yeah, so sorry about that. One way is to we note, the data on the dashboard can be used as a baseline in a way to set targets or goals for your organization. Depending on the type of work that you do or involved in, or the type of strategic plans that need to be made in your organization, we've heard from the past using statewide or region or county level data to inform your planning, whether it be for linking folks to care, for prevention work, for viral suppression targets and goals, using the contextual data or what's going on in New York in previous years, or to match trends is a way that we've heard that some folks have used data from the dashboard in their work. Another example is using local data in a grant or funding application. So just really practically, we all know that when there's need, when there's writing proposals or grants, and you have to describe the problem or lay out what the need is or what the burden is that you're trying to address. And we know that data from the dashboard, whether it just be pulling the numbers at themselves or actually including visuals, which can be a really strong tool, can be helpful in that regard. For example, we have our epidemic summary page, which puts several metrics or trends into one view, and that's an example of what I'm sharing right now on the slide. So you can go to our epidemic summary page. You can click on Erie County if you're a provider in Buffalo, and in one view you can see recent trends in new AIDS diagnoses, new HIV diagnoses, number of people living with HIV, trends in those people living with HIV who are virally suppressed. So it's just an example of pulling snippets or visuals from our site to use in your own report writing or grant writing. Also, we've heard from folks who need to do trainings or staff workshops internally at organizations with their staff, Again, going to using visuals, maps, trends, and other data on our dashboard to help kind of talk about whatever the issues may be facing your organization. And as I mentioned, advocacy, that's similar to what I've already said, but if you do work in advocacy and you are either doing mobilizing or working with communities or policymakers, we know that visualizations or images can be strong tools to help further an argument, I guess, for lack of a better word. So yeah, these are just a few examples that we know over the past. We're always trying to learn how other people are using the dashboard. We know it's cited sometimes in peer-reviewed public health research papers, but that's its own channel of work. But we are really interested in and would love to find out if folks are using the dashboard in any other ways in their work. To please share that with us. Another, and I mentioned this earlier in the presentation, but another area are these infographics we create, because what they do is they distill a lot of information into short, key summary points with big visuals, and those can be helpful as well in your work if as relevant when needed. And what we do with the infographics often is we highlight vast and persistent disparities within HIV outcomes. For example, when one population or community is disproportionately burdened or impacted by HIV than others, as you all are well aware of. And the data we have at the dashboard provides clear evidence of that, such as in testing rates, new diagnoses rates, viral suppression, etc. So our team generates these infographics on a fairly regular basis to emphasize those issues. And we encourage and support all of you using these graphics as tools in your own work as well. Speaking of disparities, and this is the slide that came up before, in December 2023, we launched a data viz featuring social determinants of health alongside HIV-related outcomes displayed by county in New York. So the creation of this tool allows for users to compare ETE metrics such as new diagnosis rates with social and economic measures like poverty, education level, and housing costs, presented alongside HIV-related outcomes. So our goal here is to highlight the importance of how structural and social inequities where people live are associated with the key disparities of HIV-related outcomes. I know that's a mouthful, but essentially you can look at it for a given county where they compare or rate, with regards to poverty level, education, housing costs to other counties in New York State, and then likewise look at how that county compares to other counties across New York State when it comes to viral suppression, mortality rates, HIV diagnosis rates, etc. So we launched that a little over a year ago, and we hopefully will be updating that page later this year as well with more recent data. Okay, so before we wrap up, I'd like to once again mention our other dashboards that we've been working on, or these other projects that are very relevant to HIV and ETE work in general. One is the hepatitis C or HCV dashboard. Similar to ETE, the purpose of this dashboard is to measure, track, and disseminate actionable information on progress towards eliminating hepatitis C as a public health problem in New York State. On that site, we include data on new hepatitis C diagnoses, so trends in diagnosis rates, as well as infections. We also present on the HCV dashboard treatment and clearance data, and that's both at the region and county levels. And we may do another webinar later this year where we go into more depth around this dashboard, and as well as our other forthcoming dashboard, the STI dashboard. So Yes, the New York Sexual Health Dashboard, not yet launched, but does have a landing page. If you go to that URL shown here, you can sign up, as I said earlier, to receive updates on when we do launch. And we're very excited for this project. We'll be featuring interactive data visualizations, key trends of major reportable STIs in New York State, which include chlamydia, gonorrhea, and syphilis. So very relevant, important to HIV prevention. So this new project will be on its own dashboard site, but be connected and look for updates soon. And please do sign up so you know when that launches if this is of interest to you. And I have been mentioned, but also, as you can see, if you're familiar with QR codes, you can scan the QR codes and link directly to these websites as well. Okay. We should, one moment, sorry about that. We will get to the Q&A in a few moments, but I just want to first leave this slide up here. So if you're not already on our email list, please do sign up to receive updates on new data, blog posts, and announcements. If you would like to reach out directly to Ane or I about any of the things we've discussed in the webinar today or other issues that you've had with the dashboard, our emails are there up on the screen. We do have accounts on X and Instagram and LinkedIn. We do post our, snippets of our blog posts, sometimes other links. If there's articles we've been referenced in, they'll go up there. And those infographics I mentioned earlier. So if you're active on social, please connect either through your own personal accounts or organizations. That would be great. But most importantly, we would love feedback on today's webinar. So how we can improve these in the future, make them more useful to you, cover the topics that you want to see covered. So there's a URL here. I think we'll put it in the chat, and also a QR code to take you to a simple form just to let us know how we can improve this for all of you. So I guess we wrapped up pretty quickly today, which leaves us, I don't know if we have a chat going, if there are any questions, but we have plenty of time for that right now.
There are no questions in the chat box. So
Okay.
you two must have done such an excellent job that you answered all the questions before they actually came up. If people have questions, now would be the time to put them in. We do have some time for that. I have questions though.
Good.
Just in terms of data, you said the data all comes primarily from the state and from other government sources for the most part. And that means that the data is, I know I saw the most recent data on the dashboard is from 2023. Some folks may know why that is, but can you just talk about why that is?
Sure, Steve, thanks. So for this population level data, for example, HIV surveillance data, the majority of the data that's on the dashboard around new diagnoses, people living with HIV, linkage to care outcomes, retention and care outcomes, that data gets reported to the local health departments, that gets then reported up to like state or city health departments. And surveillance teams there work, let's say in December 2023, someone goes in for appointment and there's a lab test or result, and that data has to get sped up. So it's going to take several months after that for teams at both departments of health to collect that data, gather it, do quality checks, make sure they have the right information. And that data is worked on for a good 6 months, past the end of 2023, December 2023. And every year, those surveillance data aren't ready for publish or public audience until December, essentially. So as soon as that data is all publicly available, we are ready on the dashboard to put it out there. That's one explanation, Steve. Trying to think if there's a does that help at all, or is there a separate angle?
Yeah. I mean, I know there's also deduplication that takes place, that the surveillance is very concerned that people sometimes show up in multiple systems.
Correct.
And so, that surveillance really wants to make sure that the data is as accurate as humanly possible. And so they spent a lot of time confirming it and making sure it's accurate. And so it does take, I mean, it's the 2020
follow-ups. There's
2024 data
in-person
will be-
follow-ups as well
Yeah.
for some of
Yep.
the data. And then for some of the other data on the site, for example, HIV testing estimates, those come from other surveys. And again, once the data is captured in the surveys, it takes months until that data is ready for public, because what the epidemiologists or analysts working on cleaning that data, as there's always a delay and there's always a time lag to receive that. I will say it's much better now than it was when we started this work. We've actually decreased the time it's taken to get data out there.
Yes, back in when we started, it was 3 years, 3 years or more before data came out, and now it's down to a little under 2 years, which is pretty good. So we'll have 2024 data in early December 2025.
Correct.
So that's pretty good. That's actually about a year after the end of the data year. So that's quite an achievement. The Hep C and the STI dashboards, are they similar to the HIV dashboard in terms of the layout and the kind of data that's on there?
They are similar. The STI one's going to look a little different actually when that launches. The visualizations aren't going to look exactly the same. I will say that the ETE dashboard, the HIV data, is much there's more data. It's our oldest project. In general, there is a lot more HIV related data available. There's more metrics that are of importance to people. I mean, we mentioned a handful of them on this webinar, but there is the breadth and depth of data on our ETE dashboard is much larger. I can actually, I mean, while we have time, I can swing back to this slide in a minute, but if people are still interested, so this is what our HCV dashboard looks like. This is the home page. So there is a look and feel that's similar. It does center on the HCV elimination targets around diagnoses, treatment, infections, prevalence, and deaths. And we present the data that is available to us from the state and city, and that right now is around diagnoses, treatment, and infections. And so within these pages, there is a level of data at the county and region level, so the STI dashboard, which hasn't launched yet, will look a little different, but the HCV one has a similar look and feel.
When do you expect the STI dashboard to launch?
I will say, before the snow thaws.
So it's going to snow Thursday.
In the coming weeks, we hope that the STI dashboard launch. I could say months, but weeks/months. Yeah.
The reason I asked that was we had talked about scheduling another webinar specifically around the Hep C and the STI, and I'm just thinking I think our first open slots are like in June.
Okay.
So I'm just wondering whether we should look at June or whether we should push it through the summer or maybe into September.
Yeah, let's talk about it after we launch, but we will be up and published by June.
Okay, but yeah, I think there will be interest in both of those, and we can probably do both because they are smaller data sets. We can probably do both in the same webinar.
Yeah, I think so. I see a comment in the chat. When looking at data by county, are you able to drill down even further, town, city, zip code, or is county as far as it goes? Great question. I wish we could drill down further. For rest of state, we do not have the ability to drill down further than county on the dashboard. So that's everything outside of New York City. I can show that briefly on so I can do it here. For New York City, we have what's called neighborhood level data. It's called United Hospital Fund data, UHF. And here's an example. On other pages, you can see this a little more blown up or a little more expanded. But that is the one scenario on the dashboard where we have data at this neighborhood level, and each neighborhood is made up of a collection of zip codes. So we actually have a useful tool. So if you actually are, you can search a zip code, and it'll at least tell you what neighborhood that zip code falls within. So that is West Queens, and then you'll get the data we have for that hospital fund. This is data that the city already publishes in their annual report, and so we receive that similar data as well. And on this page, you cannot then stratify the neighborhood by gender, age, or race, but actually we do have some other pages on the dashboard where you can look at the care cascades, for example, by neighborhood, by sex, age group, or race. So we do have we can't go as far as some people would like, and the main reason, just to finish the answer to that question, for the rest of state is because of low case count numbers, smaller population, just lower population. We can't show that data due to to preserve confidentiality of individuals and to follow data suppression rules. We can't always show case count or HIV related outcomes when the denominators or the population numbers are very low.
All right. Another question. This person says, I saw the median CD4 count on the dashboard, and they suppose all providers in New York State, regardless of receiving AI funding or not, must report CD4 counts upon diagnosis.
I can't answer that specifically because that's a clinical guideline issue.
Yeah, so providers actually don't report that level of data. Providers report diagnosis data, and then the state gets that information from the labs.
That's
So when
correct.
a lab is done, the state gets lab information.
That's correct. Right.
Yeah. So that would all come out of and that's another one of the reasons why the data, there's some delay in the data, because there's a whole process of people having to move through the system and the labs being done, and the labs having to compile that information and then package it and then send it to the state, and then the state unpackages it and again is concerned about deduplication and all of that. So so it's not a provider requirement, but it's whatever is in the labs.
Thanks, Steve. Yeah, thanks for clarifying.
And
yeah, sure. I can.
Codes.
Do we have a QR code for Hep C? I think so. Yeah, someone. Thanks, Karen. Yeah, I think that QR code just takes you to the website. And then if you go to the Hep C website, you can then scroll to the footer to sign up for our email list there.